Hey, welcome to another video from Skinny Medic. In this video, we're going to take a look here at the SOE Medical Satchel. Now this one's pretty close to the SOE Vehicle Med Bag. It's a little bit smaller, has a couple different details, so we packed it different. You guys seem to really like when I do these types of videos because it gives you ideas when you're building your own kit. So I built this one to be a complete trauma kit. We have top of the line supplies in here. We have tourniquets, we've got pressure bandages, we've got combat gauze, there's chest seals, there's an MPA. So complete all-around trauma kit in here for you, packed out, ready to go. I've been super happy with all the SOE gear that I purchased. So now at Medical Gear Outfitters, we're also carrying a few of the SOE medical bags in stock for you guys. So we'll take a quick look here on the outside. You do have some hook and loops. So if you want to put, say, like a Skinny Medic patch there, you're more than welcome to. You can put some kind of identifier, maybe you put allergies, something along there. Do have some webbing here, so if you want to put a tourniquet holster on the outside, plenty of room there. Nice bright grab handle here, so this is, you know, in your truck, behind your seat, or at the range hanging somewhere. The bright red is going to stand out. Also put the bright red pull cords on here, so there again, something that gets your attention. Really like that. So here on the back side, we have plenty more webbing space. If you wanted to attach something else to the back, you absolutely could do that, but I was trying to keep this pouch nice and small, compact, so you would actually carry it. So you have a nice long strap here that you could obviously sling it over yourself if you're going to help someone. You could hang it from your car, from the headrest, hang it from a nail at the range, whatever you need to. Plenty of choices here, and if you don't like it, it's got the quick disconnects. You can disconnect it and take them off. So over at medicalgearoutfitters.com, we're keeping the Typhon with red thread in stock. We also have black in stock, and then red in stock. Alright, so let's unzip it. I know this is what you guys have really been wanting to see anyway. What did I put in here? So let's start over here on this side first. We have the OLAES pressure bandage here. This is a great pressure bandage. Comes with some gauze if you need it for wound packing as well. So a great overall bandage here. Over here we've got some more items to stop the bleeding. We have combat gauze, which is a hemostatic agent, and then S-roll gauze here. So what I would do is if I had like a junctional injury that I couldn't put a tourniquet on, then I would go into the wound with combat gauze, my hemostatic agent, and if I needed some more backfilling, some compressed gauze here would be like what I would use to fill in the voids. Alright, so we'll slide over this side now. Have two pair of non-latex nitrile gloves. They're just kind of pushed in the little pouch here. On this side over here I put a Sharpie. There's an MPA tucked behind here. We'll take a look at that in just a minute, but you could take the MPA out of the pouch if you wanted to. Run it through. Plenty of options for these first layers of loops right here. So like I said, I put a Sharpie here. I always end up losing a Sharpie, so I tucked it in here. It's right next to my cat tourniquet and my SOF-T. I did go ahead and choose to run the latest Gen 4 SOF-T from TacMed Solutions. Did a review on that. And then we have a Gen 7 cat tourniquet. I do think it's important to run two tourniquets. You know, you may run that situation where you put a SOF-T on, you tighten it down as tight as you can get it, but there's still bleeding in the arm or the leg, so you need a second tourniquet. So you would put them side by side and then secure the second one down. So I think it's important, if your budget allows, to run two tourniquets. For me, I like running the cat and the SOF-T. So I have everything to stop major bleeding here, quick access. I have the tourniquets, I've got a pressure bandage, I've got a combat gauze back here. So everything I need to stop major bleeding, which is that first part of the March algorithm when you're treating trauma patients, is that, oh my gosh, that's a lot of blood. So we have that taken care of very quickly. The next thing we want to look at on the March algorithm is airway. So I did put an MPA in here with some lube just together right here. Then we look at respiratory, so then we have chest seals. These are vented chest seals that we can secure. Circulation, not a whole lot we could do here, not carrying blood, things like that, but you know, I teach in my classes for circulation to go back and do another blood sweep, make sure you didn't miss anything. Maybe this is where you check pulses, look for vital signs, things like that. And then the last part of the March algorithm is heat loss or head injuries. But heat loss is a big one. So these patients, trauma patients, they can get hypothermic very quickly. Hypothermic means their core body temperature starts to drop. And once that starts happening, it is bad news for your patient. So having a Mylar blanket in there could save your patient's life. It's one of the things I talk about in my classes. I'm like, you've spent over $100 on items here to save your buddy's life, and the Mylar blanket is what you need to finish the job. So I hope you guys enjoyed the video. I hope it kind of gave you some ideas when you're building your own trauma kit, some supplies you can include in your trauma kit. I'll put a link down below to Medical Gear Outfitters. That is my business if you're looking to purchase some of the supplies or some pouches. And I also put a link down to SOE if you're looking to purchase some gear from them as well. So I hope this video helps. You never know when you'll be the first responder. Remember the right gear and the right training.